Hi, my name is Christopher Castro, and today I'll be discussing med errors for Research 1. It's estimated that about 3.75 billion meds are administered in a hospital setting. And out of those 3.75 billion med errors, it was estimated in 1993 that about 7,940 med errors were the cause of death in the hospital setting. So as you can tell, based off these numbers, it is a big problem, especially being that we're administering about 3.75 billion meds in the hospital setting. Med errors are very common in the hospital setting, not just here in the United States, but around the world. The cost of these med errors, because of med errors, are increasing. So it's becoming a growing situation in the hospital, in the hospital setting, in providing care. And amongst all things, it can be very severe, if not can cause death to a patient, if not noticed or not taken care of and such. Medication errors is defined as the process of administering, dispensing, and also prescribing the med. The significance in this problem is the nurses, we as nurses, are the administrators of this medication in the medication process. And one of the biggest things is that it is preventable. Majority of them are preventable. So that's what makes it a significance. For literature search, three different resources were used. We had Cumulative Index to Nursing and the Allied Health Literature. We also had PubMed and CSA Illumina. And the research was filtered to be around 2009 and 2014, and from that a lot of articles were found, a lot of them in different languages, one is specifically in Spanish. A lot of research was done in South Korea, in Brazil, which would be this article. So it was a worldly study. A lot of people are trying to focus in on how we could prevent this from becoming a major problem or progressing into something further. So the key words were inpatient, medication errors, incident reports, and such. For this research topic, medication errors in the intensive care unit, this was the article that was used. The study was performed in Brazil by Elena Bohamel, Lais Ramos, and Maria de Incenzano. The problem of the study was intensive care patients are prone to medication errors. There's a lot of factors play into this. Part of it being it's an emergency setting. These patients are pretty much in critical care, and medication errors are mostly found in this area. The purpose of the study was to investigate the incident types, their causes, and the consequences on the patient. That was what the researchers were setting their study based off of. The study design was an exploratory quantitative survey. Okay, so based off of that, it was just a very natural setting. No independent or dependent variables were involved, and the research variable was basically determining what the incident types were, the causes of medication errors, and the patient consequences that occur in a medication error. The framework, the researchers felt as if the framework was prevention of medication errors based off of the mistakes that have happened in the past. So they wanted to create some form of an awareness of medication errors previously, so that way we can avoid them from happening later on, and with also hopes of decreasing the increase of errors. The sample, there was a total of 44 adult patients, and in order for them to be involved in the study, they had to have medical and surgical diagnosis. For exclusion, they basically, if they didn't have a medical and surgical diagnosis, they were not included in the study. The results were analyzed by Mann, Whitney, and Wilcox test. It was determined that 305 occurrences of medical errors were found within this 6-month period. Out of those 305 occurrences, 161 were caught before they were actually occurred by the staff. which is actually a very good sign, but the number needs to increase considering there's 305, only 161 were found. From those errors, majority of them were from omission errors, basically stating that the meds weren't given at a timely fashion. They were given way too late, and that can cause a situation also. One question that was identified was the length of patient stay. If it determined whether or not, if they stayed longer, were they more prone to med errors, or if they were less than 7 days, were they least likely to have an error. The limitations of the study was there was only 3 methods to detect the med errors. And the researchers felt that there could have been more methods to determine them. So they decided if there was another study done later on, then they would prefer it to be a direct observation versus the methods that they had already included in the study. There was also limited collaborations. Primarily the information that they received was from nurses. None of it was from pharmacists or from other medical staff. The implications of the study determined that since the highest cause of med errors was from omission of meds, it was determined that nursing priorities need to be more prioritization in administering medications. So, like for example, would be if a med has to be given at a certain time to one patient, then those patients need to be the first ones to get their meds, and then as the list goes on with the rest of the patients, then but basically of importance needs to go first. Another implication was also the importance of being pharmacologically knowledgeable. As nurses, we are the last stop before the med is given to the patient. So it's very important that nurses understand and know all the different kind of med interactions and what goes with this and what doesn't go with that. So it's very important for that also. And it's also important for a nurse to check and recheck, because yes, while doctors do give prescriptions out and they're the ones that sign in, the pharmacy's the one that picks it out and sends it up, we're the last people, the nurses are the last people to administer this medication to the patient. So we want to make sure that it's the right dose, that it is the right time, that it is the right drug, the milligrams. We want to make sure that we're paying attention to that kind of stuff. In conclusion, ICUs are a stressful unit. So it's understandable that these kind of things can happen, or not to say that it's okay, but these kind of things can happen. So it's important for the increase in safety measures to be increased. So what is it that we could do to try to make this better? What can we do to fix it? And that partakes in a lot of everyone in the floor on the unit, including the pharmacist and the medical staff. It includes everybody, so that way we can join together, as a team, because this is a teamwork effort, and hopefully be able to improve errors. These are my references. Okay. Hi, my name is Christopher Castro, and I'll be discussing med errors for Research 1. Med errors is a big problem